Hi, this is Dr. Andrew Turchin from Aspen, Colorado, and today I'd like to discuss some of the most common aesthetic concerns my patients have. One of my patients' biggest concerns, even before we start, is whether they're going to love the end results of their smile. So we've developed a very unique process that allows us to be the only practice in the country that guarantees you'll love your smile. And we call it the I Love My Smile Guarantee, because that is what has to happen for me to be happy, that I've given the patient the results that they need. So we developed a unique process called the test drive. And in this test drive, we actually designed a smile three-dimensionally in the laboratory for the patient after doing our usual workup of photographs and models and measurements. We have an algorithm that designs a smile very precisely. And then the patient could come back for a 20-minute session. And in that 20-minute session, we are able to transfer that smile design on the models into the mouth, and the patient gets to walk around the room with it, take photographs and videos to see the before and after side by side of what they look like. Walk up to the mirror in real life, walk around the room, different distances, and really experience how they look with it, how they speak with it, and see if it's something really for them. Because it's most important to me that my patients are confident that they're gonna love the end result. That's one of our guarantees. We're the only practice in the country that guarantees that patients will love their smile, and this is one of the techniques that allows us to do it. And it's much different than other processes out there. There's a lot of digital imaging where people take a digital picture and change the teeth within that picture. The problem is that's changing teeth, and it's not changing what we do. We change smiles. The lips and the face change shape just subtly, but enough to be really interesting. For some people with asymmetrical curves of their lip, it's pretty dramatic for them to have a symmetric lip when we're done. And cosmetic imaging can never do that. They're just changing out teeth. And it's certainly not dynamic like somebody walking and talking around the room and seeing how they feel with it over a 20-minute period. And then we just peel it off. It's a really simple process, and it's a process our patients love. It gives them the confidence to be really excited about their new smile. Then during the process, instead of just making temporaries and telling them don't worry about how it looks, which is common, you'll love the permanence, we put so much detail into our temporaries. We call it a trial smile. So you go home and you know you're trying it, and you live with it for a few days, and you come back and give us feedback, and we fine-tune that until you absolutely love that. And then we use that, we call it the dual blueprint method. We use that as a blueprint for the final restoration, and our ceramist in-house actually duplicates what you're living with right then. So you know you love it, and then we give you exactly that in a stronger, more beautiful material. It's so nice to know the end result before we fabricate it. And this gives me the confidence, it gives our ceramist the confidence, and the patient the confidence that we're giving them the exact result that they want. Every smile is custom for that patient.